It was standing room only at the Hemingway Life Sciences Innovation Center for the official announcement that the University of Kansas Cancer Center had joined an elite group of 67.
I am here to formally award the University of Kansas Cancer Center with the prestigious designation as a National Cancer Institute Cancer Center. Congratulations.
A who's who of state, local, and national dignitaries spoke at the hour-long news conference, including former Kansas governor and current Health and Human Services Secretary Kathleen Sebelius. Prior to the conference, Sebelius recalled when the process began several years ago.
I was there at the beginning. We put this in the 2007 budget in Kansas, made a state investment. The Kansas Bioscience Authority was a huge supporter, strategic investor, $50 million along the way. So, in fact, all Kansas taxpayers have contributed to this effort.
Media lined the back wall for the announcement while the university broadcast a continuous live web stream. Dignitaries shared personal stories of how cancer struck members of their own families.
Cancer is a disease that does not respect community. It doesn't respect ethnicity, race, money, power, or anything. It doesn't respect age. It didn't respect a 17-year-old boy whose mother developed cancer, and it didn't respect it when she died when I was 19 years of age.
The University of Kansas Cancer Center Director Dr. Roy Jensen was overcome with emotion at one point while he talked about the hard work of so many people and praised the community support.
I also want to thank my family. I took them from the idyllic life in Nashville, Tennessee, and told them that we were moving back to Kansas City. That was a big sacrifice.
But perhaps the most gripping comments came from a cancer survivor who shared the story of how a clinical trial saved his life.
I have 10 grandchildren. My wife and I have been married 40 years. It meant a whole lot to me to fight through this thing, and I wasn't going to let it beat me.
NCI designation is a research designation, which means doors will open to all kinds of opportunities.
We know that companies will come here to test their products. It can build a whole service center operation, and KU will be eligible for millions of dollars of additional grants.
In terms of patient care, in terms of the benefit to the region, in terms of the reputation of the hospital and the university and so on, this is good news.
The University of Kansas Hospital President and CEO Bob Page summed up the NCI efforts in celebration best when he said,
"You look at the statistics, a better survival rate for patients who are seen at NCI-designated cancer centers. It means that people in the region don't have to leave the region. They can come right here to Kansas City for their cancer care."
For the University of Kansas Cancer Center, I'm Jill Chadwick.